Hi, everyone, and welcome to today's webinar on health insurance. Delighted to be able to provide this information to you. I'm Dr. Todd Landry. I'm the Director of the Office of Child and Family Services. And as I said, we're really happy to be able to have this webinar today and to provide this vital information to all of you in the early care and education workplace. As early care childhood providers, we know that you have played such a crucial role for children and families and our communities for many years, but most importantly, perhaps, and most recently, during the COVID-19 pandemic. You, as we all know, are on the front lines, supporting working parents and others, including those who are returning to the workforce to help Maine continue to rebound from the pandemic and build our workforce and economic recovery. The early care and education workforce is absolutely critical. Unfortunately, research also suggests that sometimes early care and education workers serving children, particularly ages 0 to 5, including childcare, Head Start, and preschool teachers, are sometimes more likely to lack health and care insurance than other educators. In fact, the National Survey of Early Care and Education data shows that early care and education workers generally have high uninsured rates across the country. In 2019, 16%, nearly 16% of ECE center-based workers reported that they were uninsured. That compares to only 4% of teachers and a national uninsured rate of around 10%. That lack of potential healthcare insurance leaves our ECE workers potentially vulnerable to lacking healthcare services, to missing out on vital preventive care services, and potentially being at financial risk for unexpected healthcare costs. We want to make sure that teachers of our youngest children have healthcare insurance whenever possible. That's why the 2023 Health Insurance Marketplace Open Enrollment Period is a great opportunity for all of you as educators and teachers more generally to obtain affordable healthcare insurance coverage. With the expanded subsidies available to individuals under the American Rescue Plan, many uninsured early care educators may be able to obtain affordable marketplace coverage. Medicaid expansion in participating states, including right here in Maine, offers another opportunity for some educators to gain that needed healthcare coverage. These programs provide important pathways to coverage that can protect the health of those who educate and care for our children. I'm delighted and incredibly appreciative to have my colleague, Megan Garrett-Reed, with us. Megan is the director of the DHHS Office of Health Insurance Marketplace, and she's going to share some vital information for all of you on this important topic. Megan, thank you for being with us and for sharing this information.
Thanks so much, Director Landry, for having us and for this opportunity to share information. We are always looking to share and spread the word about open enrollment and health insurance coverage through the marketplace to anyone who could use the information or share it with their network. So I'm very appreciative of the opportunity to be here today. And we'll just note, as Director Landry said, we're in a very key period right now. It is currently the open enrollment period for 2023 coverage, and that runs for a little less than 2 weeks now through January 15th. So there's an upcoming deadline that I just wanted to highlight at the top. I'll dig into that a little bit more, but an especially important moment to be sharing this information. So I'm just going to briefly pull up some slides that I prepared today and start with just a brief introduction to what COVERME.GOV is, what the health insurance marketplace is, and some of the resources and tools that we have available. So for starters, I just wanted to start with some background, as I said, on COVERME.GOV. As of 2022, we are a new resource for finding health coverage here in the state of Maine. COVERME.GOV is Maine's state-based health insurance marketplace. You may be familiar with healthcare.gov, which has been running as a health insurance marketplace since 2014. As of last year, we took over sort of the responsibilities and the functions of healthcare.gov and created COVERME.GOV as a marketplace that is by Maine and specifically for Mainers, but provides many of the same functions. So that includes being a single place where individuals can come to shop for health insurance and to compare plans and find the plan that is the best value and the best fit for their needs. An important differentiating factor about COVERME.GOV versus a Google search or other resources that you might find out there for looking at health insurance is that all of the plans that are offered through COVERME.GOV provide quality, comprehensive health insurance coverage. So there are other types of plans outside of COVERME.GOV that are quality too, but there are also, it can be easy to sign up for a plan that seems like a great bargain, a great value in terms of what you're paying month to month, but where you may find that when you actually need care, if you have an accident, an illness, that there's a lot of fine print that actually excludes coverage. All the coverage in plans on the marketplace includes 10 essential health benefits. So that's, regular doctor's visits, hospital visits, surgery, inpatient, outpatient care, substance use and mental health treatment, really a comprehensive set of benefits. Including some coverage and care that is totally free. So preventive care is provided at no out-of-pocket cost under the plans that are offered on COVERME.GOV. COVERME.GOV is also unique in that it's the only place to go to check and find out if you can qualify for federal financial assistance that Director Landry mentioned that can make your health insurance premiums and costs more affordable. That comes in two forms. The first is advanced premium tax credits, also sometimes referred to as subsidies, or we say financial assistance. And those are payments that lower the monthly premium that you pay for health insurance. And then another type of financial assistance called cost sharing reductions. Those are actually also federal payments that lower the out-of-pocket costs that you pay for a plan. So provide lower deductibles, lower copays when you're actually seeking and utilizing care. Really like to highlight those. I think that's really important in this day and age. I know a lot of folks sometimes feel like I'm paying for health insurance, but the deductible is so high that it's really hard to feel the value unless there's a kind of catastrophic event in your life. But those cost sharing reductions, which I'll describe in a little bit more detail, for folks eligible for those, they can really help to make you feel the value of the health insurance even sooner. And another benefit to COVERME.GOV is that when some people apply through the marketplace for financial assistance, they'll also be considered for MaineCare eligibility. And if they appear to be eligible for MaineCare, we at COVERME.GOV just automatically transfer that application over to our colleagues here at DHHS in the Office for Family Independence, and they make a final determination of eligibility for that program. So it's great because it means you don't need to try to figure out on your own what you may or may not be eligible for. Sometimes families can have mixed eligibility with parents qualifying through the marketplace, but children being eligible for Cub Care or MaineCare. And so it's a kind of an easy one-stop shop for eligibility. We also wanted to just quickly walk through eligibility for COVERME.GOV. It's a little bit different than what folks are used to with, for example, a program like MaineCare, where there's kind of clear cutoffs based on income amounts, but at the very basic level, almost anyone is eligible to buy coverage through COVERME.GOV. There's only a few exceptions to that. So you do need to be a resident of Maine specifically to use COVERME.GOV. For folks in other states, they access the marketplace through different platforms. People who are incarcerated are not eligible to enroll in coverage through COVERME.GOV. And you do need to have a documented immigration status or be a citizen. Although families apply together through COVERME.GOV, and people who are undocumented are ineligible to enroll themselves, but they can apply on behalf of somebody else. So for example, a parent who may be undocumented but has a child who is a US citizen can apply for coverage for that child through COVERME.GOV. Where it gets a little bit more complicated is eligibility for the financial assistance available through COVERME.GOV. Generally, folks are eligible if they don't have access to what's defined as affordable coverage through another source, like an offer of coverage from their employer or being eligible for MaineCare or Medicare. The definition of affordable, and the reason I put it in quotations here, is that the premium would exceed about 9.6% of their income for a given month. That's in federal statute, so that's defined by the federal government. But essentially, it means that if your employer is offering a premium that would cost you less than that, you are ineligible for financial assistance in the marketplace. But if the offer of coverage from your employer would exceed that benchmark, you can still qualify. And that's built into the application. You don't need to do that calculation yourself. We do that for you if there is anyone who has the offer of coverage from an employer. The other factor is the cost of a benchmark plan, as we know it, kind of the cost of what a premium would be as a percent of your income. And what that percent is based on a sliding scale from 0% of your income at 150% of the federal poverty level. So really meaning anyone at that federal poverty level or income level would qualify for financial assistance, up to 8.5% at 400% of the federal poverty level and above. That's a change. The new law that Director Landry mentioned is changed that. It used to be that anyone with an income at 400% of the federal poverty level and above was ineligible for subsidies completely. But now for folks whose cost of a premium without financial assistance would exceed that 8.5%, they can qualify. That is actually really meaningful here in the state of Maine, especially for older adults. Their premiums can be more expensive than those for younger people. And so we do see, quite an impact from that change in policy here in the state of Maine. So like to highlight that, especially because folks who may have applied 2 years ago wouldn't have qualified now because of that change in federal law, they would. Just briefly too, wanted to touch on the application. I'm not going to walk through a whole application today just because it takes a few minutes to go through, but just want to highlight that it's a pretty quick and easy process to apply online through COVERME.GOV. Generally, you just need date of birth and social security numbers for members of your family. And what we mean by family in COVERME.GOV is anyone kind of included as spouse or dependents on your taxes. And then estimated income for your whole family for the upcoming year. Documentation of income isn't required when you apply. You just are making a projection. And then it's helpful but not required to have information from immigration documents if there is anyone applying who is not a citizen. But you don't need to provide a lot of documentation at the application process. Really, most of it is information that you probably know or have jotted down somewhere and can fill in. So I would say typically, especially for a household of one with just one job or two jobs, who has a relatively easy time estimating income, the application can take just 15-20 minutes. It's a pretty quick process. That being said, I know it's complicated to understand the eligibility rules and can be an overwhelming process to apply. So I wanted to pause here, and I'm actually going to stop presenting the slideshow and spend a few minutes just walking through the tools that we have on COVERME.GOV available to try to make this process a little bit easier and a little bit simpler for folks who are applying, especially for the first time. I'm just going to change up what I am presenting here. Start with the homepage of COVERME.GOV right here, which you can see. Just a reminder again about enrolling by January 15th. And I wanted to show what we call the Plan Compare tool. That's available right here with the See Plans button or from the Get Started menu under Compare Plans, See 2023 Plans. Plan Compare is just a very quick and easy way to get an initial assessment of eligibility for your household for the financial assistance that you may qualify for. While it's not, a definitive eligibility decision, it is quite accurate for most typical situations. There's a few, kind of edge cases or complications that it doesn't capture, but for most households, they'll find this to be quite an accurate estimator of their eligibility. So the first step is just to enter zip code. That's because the plans that are available and the financial assistance varies a bit across the state of Maine. And then the Plan Compare tool will just ask for a few pieces of information. Really the only required information on this page is the age for any family members. I'm just going to enter in adult, and then a couple of dependents, just to give a sense of what this looks like. There are a few more questions that are posed. So you can rate your health and enter any expected procedures. Always like to highlight this is not information that is stored anywhere or passed on to a health insurance company in any way, shape, or form. We ask these questions because, as you'll see on a later page, it helps us to assess the total cost of a plan for you. So there are plans that may have a lower monthly premium, but higher costs if you're actually accessing care. So somebody who knows they have a surgery coming up or knows that they have some health conditions that mean they're needing many prescriptions or needing multiple specialist visits, that plan might also actually cost them more in the course of a full year than a plan where they're paying a little bit more each month for a higher premium but have lower out-of-pocket costs. So that's the reason for those questions. And then we have a few more just to get at additional factors, like what I mentioned before in terms of the offer of affordable coverage. That helps us capture eligibility a little bit more accurately, and then some other factors that impact eligibility either for the marketplace or for mean care like pregnancy. After that, you'll be asked to just enter an estimate of income. And this is one of those examples. I just put in $35,000 for this individual, where the eligibility is different for different family members. So the two dependent children I entered in would be able to qualify for mean care coverage. And then for the adult who would be eligible for marketplace coverage, you can see here that they would likely qualify for a tax credit of $428 per month and cost sharing reductions of 87%, those cost sharing reductions that I mentioned that lower deductibles and out-of-pocket costs. The tool also lets you drop in doctors if there's any doctors that are really important that you want to make sure are in the network, as well as prescription drugs that you may take, and it'll share information not just about whether the prescription is covered, but also what the out-of-pocket costs are. That was something really important for us to include. We know that's increasingly a big part of healthcare costs for many people. So that just helps to make a more informed decision about the health plan that's going to be the best fit. It's just going to take a moment loading here and sharing a little bit more about that methodology that I mentioned, where plans will be displayed with this annual cost estimate that's not just 12 times the monthly premium, but the premium as well as an estimate of the out-of-pocket costs for the individual. And you can see here for this individual example, there's a silver plan available for just $10.57 a month, with a deductible of just $500, out-of-pocket limit of $2,400, as well as a display of all the other plan options available. You can see here there's even lower premiums available of just $1 for this individual. Of course, the results here are dependent on those eligibility factors that we entered, but it's just a great tool to really be able to get a sense of what the options are going to look like without completing a full application here. So to go back to the home page, I'll just briefly share as well. So that's a step to get a sense of eligibility, but to actually get a determination and be able to enroll, an individual would need to create an account and complete the full application. So that can either be done by going to this new consumer page under Get Started, or just going to the sign-in page and then creating an account there. The other tool that I wanted to show while we were presenting to this group is our information for small businesses, small business decision support tool. I know in this audience, a lot of our focus is on if the individuals watching are uninsured or know someone who could use coverage. But I know in the early childhood education and childcare space, many of you also might be business owners, might have employees, and be thinking about offering them coverage or wanting to share resources with them. I know I've had those questions previously when kind of presenting or interacting with folks in this line of work. So wanted to share this tool because it's something that we created after feedback from small businesses around the state who maybe had worked with brokers or been looking into insurance, but really felt like they wanted to get a better sense of all the options available to them for coverage for their employees. and just get, a feel for the benefits and potentially drawbacks and the different benefits across their kind of roster of employees from different coverage options. So this tool is definitely not, exhaustive. It, for example, does not include information about every small group plan available across the state of Maine. It's really meant as more of a informational kind of tool to generate thought and give some resources to small businesses, especially to bring back, for example, to the broker that they're working with, for discussion and for consideration as they're thinking about how to balance the cost of insurance with wanting to offer that benefit to their employees. So this, you'll see, looks very similar to the Plan Compare tool. It was built by the same vendor and is somewhat similar, starts again with zip code because that is so key to the plan offerings in the state. It will ask for number of employees and then just for some basic information. I was going to do our names, but maybe I'll just do Jane. And then I will ask you just to put in age for them and their annual wages, because that's going to impact some of the options available to them as we move on and the tool does the calculation. So I'm just going to put in a variety of ages and a few different income levels for them as well. Again, this is annual wages. It will then ask about start date for contributions and how much you're interested in contributing per employee, what you have in the budget for your small business. And then what you'll see is it will present the impact of kind of 3 different options for coverage for employees. So the first of those is offering small business health insurance, so a fully insured small group plan that you would buy from a health insurance company, usually with the assistance of a broker, that would cost about $306.31 here for the employer. And you can see that there is a range of costs for the employees. You can click on the See Details page to kind of break that out and get a sense of what it means for each of the individual employees and why. So their kind of net monthly premium under this option, and see that there's quite a range here for the different employees of the impact on them, as well as the differential cost for the employer for each of them. And again, that's impacted by age of the individual employees, generally impacted mainly by their age. Another option is the health reimbursement arrangement, HRA. That's a fixed contribution from the employer each month that the employee can take and apply towards their health insurance premiums. Again, shows a different impact on the employee. One thing to note about HRAs, if they are offered to the employee and they meet that affordability test that I mentioned earlier for employer-sponsored coverage, of sort of allowing the employee's premium to be less than that, roughly 9.6%, they are disqualifying for advanced premium tax credits. If they do not meet that affordability benchmark, if the HRA contribution from the employer is limited enough that it wouldn't meet that affordability test, the employee still can receive advanced premium tax credit. So just important to kind of consider. There may be cases, if you're considering an HRA, in which some or maybe even all of your employees could receive more financial assistance from advanced premium tax credits through the marketplace. So I always just try to highlight that as a little extra flag for employers to think about, especially if potentially you already have employees who are accessing coverage through the health insurance marketplace. And then the last option here is raising wages and allowing that employee to receive advanced premium tax credits through the marketplace. So there's a lot to consider there. It's certainly a complicated, I know, decision for employers to be thinking about. And again, this is not something designed to just provide an answer, but I just wanted to mention it as something that might be a helpful resource, again, if you're a business owner and thinking about this question, grappling with it. And I'll just highlight again that we really encourage, reaching out to a broker in particular. If you're working with a broker through COVERME.GOV who's certified by COVERME.GOV, they should be able to kind of help you weigh the cost and benefit analysis of offering coverage yourself versus directing consumers over to COVERME.GOV to purchase individual health insurance. I did also, while I'm speaking about small business insurance, briefly highlight one other program that has some narrow eligibility rules, so not a huge amount of take up in the state of Maine, but I did think that this group might be one that would particularly be more likely than others to benefit from it, and that's the Small Business Health Options Program, also known as SHOP. This was created by the Affordable Care Act and is a program that can provide tax credits to small businesses that offer coverage, small group coverage to their employees. Just briefly, we don't administer the program, so it's really the IRS and a broker that are the best resources on the program if you may qualify, but it is available to businesses with 25 or fewer employees and who offer an average salary of about $58,000 a year or less. They need to buy a qualifying plan, and here in Maine, those qualifying plans are just offered by one health insurance carrier, that's Community Health Options here in Maine, and contribute at least 50% of the premium for their employees for those plans. The program is time limited. It can only be accessed or you can only receive the tax credit for 2 consecutive years under the SHOP program. But if it sounds like those other factors, apply to you and your business would fit those, definitely something to, again, ask a health insurance broker about or dig in and explore a little bit more, because it could be something that could benefit you and save a little bit of money on your taxes if offering small group insurance is something you're interested in doing. So I will close out of this window and jump back to my slide deck. The last thing that I just wanted to cover was a little bit of information about how to access help. We know, as I said, again, that this is a really complicated area, and there may be questions that, depending on your circumstances, there may be follow-up about how to handle a particular scenario or situation, or just get some assistance in filling in the application. So we have a couple types of certified individuals who are available to help people in Maine and who are actually local here in Maine. I've mentioned brokers many times during this presentation. Brokers are professionals. They sell insurance as their job. And they can, in particular, help you if you're trying to decide between different plans. They can provide advice, provide guidance on selecting a plan, as well as submitting the application. And brokers generally will be compensated by one or more health insurance carriers that offer products through COVERME.GOV, but their help is available for free to consumers. Maine enrollment assisters are a slightly different flavor. Those folks typically work at nonprofit community-based organizations or healthcare providers in many cases. They can be volunteers or full-time employees, professionals. They are trained and certified by COVERME.GOV as well, and can provide unbiased advice. They are not permitted to kind of direct you towards one plan or another, but they can answer questions, provide extra information about decision points when you're selecting a plan, and can definitely help with completing the application. In particular, Maine enrollment assisters typically are trained on both COVERME.GOV as well as Maine Care eligibility. So if there's any uncertainty about which program you may qualify for, or questions about that, they're a great resource. We also have our Consumer Assistance Center for COVERME.GOV. They're available at 866-636-0355. They're a great resource as well for questions, or if there's any technical issues as you're going through the application, or need any other kind of help. Encourage reaching out to them. They are open during open enrollment from 8 a.m. to 8 p.m. On weekdays, and then 9 to 5 on Saturdays, as well as some extended hours that we'll have leading up to that January 15th deadline, which I'll just mention again. So again, we just have the open enrollment period for 2023 coverage. So January 15th is the deadline for anyone who needs coverage to just come in, apply, and enroll, no questions asked. outside of that date or after that date, there are certain life changes like having a baby, getting married, moving into the state of Maine that can qualify you to come in and apply and enroll, but you do have to have one of those qualifying life events. It's not kind of the wide open door that we have right now. So I think I dropped in the date here just to make sure to remember that. And I think I will end there. Just thank you again for having us and for this opportunity to share information. I will just note, if you have any questions, Jillian Clark at Maine.gov is a contact point on our team. She's our associate for outreach and communications, and she can take any questions, funnel them to the right folks on our team. We'd be happy to follow up, answer questions, provide more information if we can, and just appreciate your time and attention today and this opportunity to share information about COVERME.GOV and health insurance options. So thank you very much.